today, maybe this will be our second last class. I hope by next week we should be able to end. Now today, I want to divert a bit. I want us to look at the traditional practices which are a little bit common in our communities, and they have are of clinical relevance in your practice. So that's what we are going to go through. And yeah, I think the class is almost there. We are now 49. Yeah, please encourage your colleagues to come on. Yeah, these they look simple, but these are important issues. You are going to encounter them in practice. It helps us to build the knowledge base so that we can identify these kind of situations and know how to deal with them. So, yeah, to remind the class, I'm still Wilfred Arubaku, and yeah, trying to come out of the COVID lockdown slowly, and hopefully everything will be okay. And also, I wish that you are revising. It's not easy, but please keep steady. Yeah, now I'm going to put off my video. Yes, I only put the video to remind you that I'm still the same. I remember last time we agreed that it may not be easy because now that we are learning online, you may say, oh, who is this man? And yet he's the one who has been teaching you some time back. So yeah, so I'm going to put off my video and then share the slide. Thank you very much. Yes, I've started sharing the slides. Please, if you are able to see it, one or two people could just post.
Yes, doctor, we are able to see it.
All right, so I can proceed. Thank you. Yeah, good. You guys might have to be patient. I don't know, for whatever reason, the network is a little bit weak here today on campus. In case it goes off, you just bear, I'll try to reconnect. But let's pray that nothing happens. It has been on and off, kind of, yeah. Good. Yes. So the issue we are going to cover today is about to chew very well, then you are not going to extract all the nutrients because the digestive surface area will be reduced, and so then the nutrients, some you will be able to lose them. That's one for nutrition. So then you know that the dentition are for key also for creating the facial profile. Yeah, your facial profile is so much dependent on the presence of the teeth and how they are actually organized within the maxillary and mandibular arches. Then, more still, you will come to appreciate that the dentition are very important when it comes to a beautiful smile. Human beings are social animals, and as social animals, our smile communicates. And so you need your dentition. Then the dentition are also very critical in speech. So when you lack your teeth, your speech is going to be altered. Maybe finally, the dentition are key in the growth of the jaws. And so if you lack your teeth, your jaws are not going to grow normally. So those are some of the important reasons why the dentition are very critical and why they need to be protected and why we need to understand about them. I've not talked about issues related to the teeth and systemic disease and so on and so on. But I've just highlighted for you issues which are obvious, which I think you already also know very well. Yeah, so therefore, it is important then that we appreciate issues when they are affecting the dentition. And so some of the traditional practices, we are going to look at them because of those reasons. So by end of this session, we should be able to define the key concepts in traditional infant oral mutilation practices. For example, state alternative nomenclature related to infant oral mutilation, and then the epidemiology, and then also be able to explain the etiology of false tooth concept. We have to be able to discuss effects of the practice, and then state other related practices of dental mutilation. So, infant oral mutilation, which I have abbreviated as IOM, infant oral mutilation. This is defined as the practice of gouging or extirpation of the healthy primary tooth germ of neonates and infants, neonates, infants, newborns, and so on, purportedly for curative purposes. Purportedly for curative purposes. And so we are going to explore more about this. Yeah. So here I have reproduced some of the alternative nomenclature, the naming, okay, of the concept of infant oral mutilation. Yes. Yes, so this alternative terminology will include things like dental mutilation, milk tooth extraction, deciduous canine tooth bud enucleation, primary canine enucleation, canine follicle extirpation, primary canine enucleation, dental ablation, tooth bud extraction, tooth bud gouging, stroke enucleation. And even there's also, I think, other concepts such as nylon tooth extraction, which is used like in Tanzania and so on. In Uganda alone, some of the terms used just in Uganda, these are specific to Uganda. If I pronounce some of them wrong, I think you may bear with me, like ebinyo, okay, which directly translates into false teeth, okay, ebinyo. Then I think that is in Bantu language, okay, Bantu language. Then there's Tolak. I think it's one of those Luo languages, Gidong, and then Lakejo Marat, also in Luo, which means bad teeth. Then Gira Kwanya, which translates into that which is removed, and Ikela or Echela. Then, of course, Abino, then Bino, and also Killer canines. So this is how the false teeth are described in Uganda. And the advocates believe that these teeth are kind of like worms. They are worms which need to be treated. So where does all this come from, the theology? This is grounded in cultural beliefs, okay? Cultural beliefs that the swelling in the area of the gums associated with unerupted primary teeth will result or will cause illness. And these illnesses include things like diarrhea, prolonged fever, vomiting, loss of appetite, dehydration, infectious diseases, things like gastritis, aspiration, bronchopneumonia, and growth retardation. Anything which they see or feel related to these things which I've mentioned, yes, they will think is arising out of a bad tooth. And in the literature, some of the other reported reasons for this will include general malaise or ill health, and also when these babies experience itching gums, and also when they're crying for unknown reasons, and also when they fail to suckle, And so maybe here, I would like to ask you, and then you can post in the chat room. In the chat room, yes. What does Olega opinion mean? Then there's Tolak, yes. Now in the chat room, please, can we post possibly your personal experience in your village? You may say, where are you coming from? Where are you coming from? And I can see somebody is complaining that I should not check in the chat room. I'm checking in the chat room because I want you to post in the chat room that in your village, okay, where is that village located in Uganda? Do people still talk about ebinyo? If so, how do they describe ebinyo or false teeth? At least I would want to see answers from every region of Uganda. So I'm now in the chat room. Yes. I can see some guy has come very late. He's called Alan. He doesn't know the topic. We shall tell him after. Okay. Now Nathan now appreciates. That's called a bino. I think that's a bino. And then Elias says Olega ebino means body in Kasese. Olega ebino. In Masaka, it's bino with the double N. Yes. And they still talk about it. They still talk about it. Then in Nyoro, Chemical Ali, I thought Chemical Ali was a country there in Iraq, but I can see Chemical Ali is here. He's saying it's called a Binyo in Bonyoro, then a party there in the border, it's infant oral mutilation, but in the local language, how do they call it party? Yes, Richard Opoka says actually it's Tolak, yes, referring to disease of the tooth, disease of the tooth. Okay, paddy, how do they call it? In Congo, it's Ibinyo with I. Yes, Ibinyo with I. Then Mitiana, of course, should be similar to Masaka. Yes, it's Ebinyo. Yeah, but the question, are people still also talking about it there in Mitiana? It does. Then Meru, how do they call it in Meru? In Meru, now there are many. It's Ebina, yes. In the base, bio. Wow. So there are very many concepts. Now I can see this beautiful. Yes. Wow. Kachere. Where is Kachere? I don't know where Kachere is. Mukisa, where is Kachere? It must be here in Southwestern, but where? Kabale, yes. Yeah, I know Kabale very well. I've been there, but now Kachere, yes. Good. Fantastic. Now, this in this class, there's nobody from West Nile and which other area? I think the rest of the areas have been represented very well. What about in Mugisu? The Bagisu, there are no people from Mbale here in this class. In Tororo, it is yes, Lakijo Maraj. Yes, the convert and the dramatry, they represent West Nile, but are they absent in this class? Yes, Godfrey is saying, have you ever seen a neonate born with one long tooth in right? Okay. In Kabyanda is a common practice. Now, that tooth which a child is born with is not a binyo, that is called neonatal tooth. Yes, those ones do happen. They do happen. A baby is born with a prematurely erupted incisor. So it almost always happens to just be one. Because they are not properly developed, they have no roots, and when they remain, they also hurt the nipples of their mother. We almost always remove them. So yeah, those are neonatal teeth. Thank you. Yes, Esinjiro. Then this is serious. Yes. In Samia, yes, Samia is Amachimo. Wow. Good. Now, this, but we shall wait for those two West Nilers. Yes, now the Warren is the one who is defending the West Nilers and saying that it is called kere kere. Okay, good. Now, now I'm going to go back to the slides. Now, this was to help us ground ourselves in the concept to appreciate that this is not only isolated situation in maybe parts of Uganda, but it is almost affecting the entire country, affecting all the tribal groupings. And so I'm going to present a map of the distribution of albino, and it will show for you its epidemiology, kind of how widespread is albino and ritual extractions across Africa. So it's again not only affecting Uganda, it's affecting the African region. So here you will see a map with the green triangles demonstrating the spread of infant oral mutilation across Africa. You can see that it is in West Africa, it is in Central Africa, it is in Eastern Africa, it is in Southern Africa. Yes, you can see these West African countries, Central Africa, this is the whole of Sudan, North and South Sudan, and you see the neighbors here, the Horn of Africa, Somalia. Okay, here I think this is Kenya, and here is Uganda. Okay, and yes, you see this is Ethiopia, and yeah, Tanzania. Okay, and Rwanda. I think okay, maybe Burundi. Yes, Burundi. Of course, also Rwanda, which is also very small here. It's too hidden to be seen. Then these other Southern African countries, yeah. So it's widespread. You can see this is the entire sub-Saharan Africa. This is how widespread this practice is. So now the next question is, when babies are subjected to albino, what are the effects? Okay. Now, maybe let me also just see in the chat room. Very good. Alex already has posted sepsemia. Please, I want many answers from different people. What do you think, or what have you seen as the complications of albino? You can post all short-term, long-term. Failure to breastfeed, poor cosmesis, poor dentition, looking too ugly. Anemia, bleeding. Okay. What more? What more? I'm waiting. Infections. It's like those two were discussing their answers together. They posted at the same time. Dehydration, infections, altered speech. Okay. Any other death? Yes. Why do you forget death? Yes, death. True. Delayed eruption. Yeah. Oh, wonderful. One more. Stigma, dental abscess, pain. Good. Sometimes during the extraction, parts of the tooth may remain and the recurrent infection. Yes, true, 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 very much true. Okay, this is wonderful. Let me now try to summarize these beautiful ideas which the class has presented. So I've outlined here that there can be short-term and long-term. So of course, you know, short-term is soon after the procedure or during the procedure. Then long-term is both psychological and the dental side effects, just like the way you outlined. Yeah, looking too ugly, that is a psychological issue. Okay, out of a physical phenomenon. Okay, in the period immediately after the procedure, the common risks which actually do happen include excessive bleeding, infection, then osteomyelitis of the jaw, maybe in the week after or so, normal, tetanus infection, meningitis, aspiration, because the extract, there can be bleeding, and then the baby does not control and can aspirate. So causes causing aspiration, bronchopneumonia, and the transmission of infectious diseases. In the olden days, HIV was very common, and because of the use of unhygienic and sterile instruments, so there could be cross-infection with HIV, hepatitis, and ultimately death. So maybe before we proceed, I think let me ask a question. There is this term here called norma. Okay. So in the chat room, please, can you let me know what norma is? Because I want that I know the rest of the terms, we know them very well. We know bleeding, we know infection, we know osteomyelitis, we know meningitis, we know tetanus, we know everything. What about norma? What is a norma? I see already somebody had questioned norma. So what is norma? What is a norma? I'm waiting here inside the chat room. Anybody out there who can let us know what norma is? I'm sure now some of you are busy asking Uncle Google, what is norma? So whichever, what is norma? The normal that I know is like a gangrene of the face, usually caused by a bacterial infection. Normal is a type of gangrene that destroys mucous membranes of the mouth and other tissues. Yes, yes. A severe and aggressive gangrenous process that affects the mouth, nose, and lips. Wonderful, wonderful, wonderful. So, the lookout, and you see a patient of normal, you may want to ask or inquire or investigate, where was that child or neonate yes, it is okay. Now, since we are learning, Emmanuel, don't worry. Yes, we are learning, so it is good. An answer is better than no answer. So, yeah, that is very good. It has helped us to learn about normal. Now, yes, I was still saying that when we see a patient who has a gangrene of the oral mucosa, which can also affect the oral bony tissues, the maxilla, the mandible, and it is quite aggressive, unlike the normal periodontitis, and it is possibly extending to the lips, okay, and the cheek, lips, the tongue. Normal is so aggressive. Its alternative name is called Chagram oris. Chagram oris. It is very aggressive. The exact organisms which cause normal are actually not well established. Though the hypothesis is that normal is caused by maybe a myriad of microbes. It could be a mixture of fungi, bacteria, and viruses in fairly immunocompromised babies. Immunocompromisation in form of due to maybe malnutrition or other underlying causes could be the precipitating factor in the presence of mild trauma. So that is what normal is. And to be good, now that you guys have discovered Uncle Google, you will check maybe some pictures. I have some presentation of on it is a report I wrote many years ago about normal, and but it is simple. Just ask Uncle Google Chagram oris normal, then you'll be able to see the pictures. They are quite aggressive, and you may one day come across a baby who is suffering from normal, and you need to make really quick decisions because normal is quite fatal. It's fatal. So earliest treatment of such a child is always going to save a life. And so that's why I've emphasized, and you can imagine that the exposure baby to infant oral mutilation and it complicates into normal, then that's not going to be nice. It's not going to, and all these other ones, osteomyelitis is not nice. Meningitis is not nice. Tetanus, I've seen we lost babies on the ped ward due to tetanus resulting from this. Bronchopneumonia due to aspiration, this is fatal. HIV is also, all these are fatal. So this gives us a reason to be on the lookout. Earliest intervention is almost always going to be critical. Okay. That was the short term. Then in the long term, what happens if that neonate infant survives the immediate sequel? What is going to happen in the long term? What is going to happen in the long term? In the long term, one of the possible outcomes is deficit in weight gain. Okay. So, you know, the early years are almost always very important in a person's life. You fail to thrive early in life, then you are not going to gain, you know, full stature. That is going to affect you in the long run. Then there is dental alveolar sequel. You guys understand the structure of the dental alveolar. You know why it is important, okay? So this can range from hypoplasia of the crown to complete tooth agenesis, you know. So hypoplasia will mean poor mineralization and so on of the dentition, and then to the extreme where the teeth are just not really proper formed at all. Okay, yeah, so that is critical. Yeah, even you already know from the lectures with Dr. Kwezra that hypoplasia itself is not good. Yeah, hypoplasia is not good. Then, this complete tooth agenesis is a result of the damage to the dental lamina. Okay, yeah, it's due to damage to dental lamina, and there can also be damage to or ablation of neighboring teeth. You know, normally they tend to enucleate the canine. And in so doing, because they are not experts, they may do extensive trauma, which can end up damaging the dental follicles and so on of the neighboring teeth. Okay, the neighboring teeth, the lateral incisors and the first premolar will be the likely culprits. Okay, so in the long run, you will find that a person is missing a canine, they are missing a lateral incisor, they are missing a premolar. So you start wondering what happened. Okay. Yeah. So those of you who will be clerking the PID, you can be on the lookout. When you see a baby is missing those kind of teeth, and yet they have not reached the age when they are supposed to be shedding those teeth, then you can become suspicious. And you should actually become suspicious. That is the only way you are going to help those parents to prevent a recurrence of that kind of instance in future children. And you already stated that due to that kind of procedure, loss of the teeth prematurely, then you are likely going to get things like dentofacial malocclusions. And somebody said that you will be looking very ugly. Okay, the ugliness is a result of the dentofacial malocclusions. Yes. This last one, mandibular maxillary bony tumors, e.g. the radiculocysts. This, I think, we have seen lots and lots of this kind of radiculocysts, particularly as a longer term complication, yeah, among victims of infant oral mutilation. Yeah. This, you may not see it immediate, maybe they are now 6 years, 7 years, 10 years, then a person presents with, you know, a swelling, a jaw swelling, yeah, and when you take history, when you examine, when you do investigations, radiographic and so on, then at the end of the day, you actually find it is a result of maybe a tooth which has been damaged, okay, and is retained inside the jaw. And so, yeah, it will end up creating a radicular cyst. Okay. I see there are a few questions in the chat room. Yes. Oh, yes, even when you come to the PID, that's nothing. I think whichever time, whether next year or whichever, you will need to keep an eye on the babies you are going to be working on. Yes, when you are in 5th year, I think. So now you are going to be more critical. Yeah. Then Godfrey, I think, was asking a question. He said, is there any racial or genetic? Wow, this is a hard question. Is there any racial or genetic predisposition to the first teeth occurrence? Alice has asked, are first teeth real? So maybe let me first answer those questions before we proceed. Are first teeth real? How do I answer? Okay, the simple answer is really they are not real. But is the concept of first teeth real? The answer is yes.
Doctor, there's someone.
Yes, there's somebody who's whatever is on. I'm getting an echo.
Yes, yes. Please make me co-host or you mute him. Because I went off and I lost.
Hello? Okay. He has here. Oh, let me see.
Still on.
It was that I don't see any statistics from the developed countries. Does it mean it doesn't occur in developed countries?
Okay. Now the infant oral mutilation is a practice. It's more a practice. It is what people are doing out of a belief. You know, health. There is the health belief model, which explains what people actually do and how people see illness and disease and things like that. So now, where does this situation come from? What is the science? The science is that number one, in the okay, I think maybe Dr. Quizra didn't tell you this. The canine teeth, I think last time we discussed, happen to be having the longest roots and they're quite large, okay? And when they are even still not emerging, when they are still forming, when they are still within the jawbone, they tend to create a prominent, what we could say maybe a prominence, yeah. So that part where the canine teeth are will almost appear to be more prominent, more raised. And when infants, newborns and the like experience maybe illness. You know that many illnesses in newborns, infants, and so on will result in fever, and fever ultimately dehydration and things like that. Now, when a baby is dehydrated, that prominence is exaggerated because you see there's dehydration, and so the canine prominence will appear whitish because the mucus, the mucosa will be pale. So as it appears pale, it's more light, you know, almost like white. And so that is where the traditional people will believe that there is a worm there. That white thing below we are seeing is a worm, and it's causing a swelling. And this is swelling, and the presence of that worm is what is causing this baby, okay, or the newborn to have fever, to have diarrhea, to vomit, to lose appetite, you know, all those signs and symptoms which will be seen. Yeah, so yeah, that's where it starts from. And therefore, does this happen elsewhere? Children elsewhere also fall sick, but because of the approach to healthcare, you know, elsewhere, let's say in Europe, a baby, first of all, small babies are less likely to fall sick because their environment is much more secure. Their mothers are healthier, the babies are born much healthier, so they're less likely to fall sick. And so that, of course, now reduces the instances or the prevalence. Now, number two, when a baby falls sick, let's say in Europe or in the more developed countries, the parents are more likely to seek for healthcare in the conventional health setting. So the root cause of their illness is more likely going to be identified early, and the baby is likely going to be treated early. Now, as opposed to our setting in sub-Saharan Africa, where people are extremely traditional, where people practice both alternative and healing practices, which are traditional, and when that fails, actually the traditional healing practices are almost like the first line of care. And in the event that that fails, that's when they are going to seek the conventional healthcare. So this is where it is coming from. And you know, in Africa, practices tend to be shared. And so that said, research and publications from Australia, from US, from Sweden, I think the Netherlands and the US has indicated that African immigrants from sub-Saharan Africa who go to those countries, they may be living in London or New York or where in Sydney, they sometimes go to those countries with their practices. So there have been case reports from those countries about the presence of this practice among the African immigrant communities in those countries. And therefore, there's organizations which have been calling, you know, for campaigns to end the practice in Africa so that it doesn't continue to spread. So that answers, I think, the question whether this happens elsewhere. Why is it more in our setting? Then does it have a genetic predisposition? Okay, there are people who argue that every illness, every disease, every death could be explained based on genetics. So if we argue like that, we could say, yes, it has a genetic basis. But then what are the direct genetic underpinnings? Okay, I think we may want to argue that because where is it coming from? It's coming from the fact that maybe a baby is not being well fed, or the mother's breast milk, the quality is poor, okay? So the baby falls ill, or the baby is exposed to an infection, maybe of the umbilical cord during the birthing process, and they're fallen sick, okay? Maybe they've been infected with malaria, and then they're fallen sick, or any other infection, they're fallen sick. So you know that there is always behind the scenes a genetic basis for any infection, any disease, or anything. It always contributes. So that said, we could say yes, but are there specific genes which can explain why a baby will be subjected to infant oral mutilation? I may say really no, not at all. So let me see what were other questions. I think there was another question. Wow, there are now very many questions. So maybe let me first proceed, then I will come back to answer some of these questions. There's a hand which is raised. Yeah. There's a hand. Jolly, I think it's Jolly. Where is has the hand been withdrawn?
No, it was a mistake. You can continue.
Okay, good. Yeah, so now the questions are many. So let me first finish the slides, which are not many now, and then I can now come and we discuss some of those questions. Yes. Yeah, so yes, so yes, long term, we have outlined them, we have discussed them. We are going to now look at the other mutilations, which you as a medical practitioner may come across in our setting. And these include the intentional dental ritual of resetting or mutilation. This is done intentionally, okay? They do reset, or even sometimes they can remove the anterior incisors, okay? I think you have seen some people in Uganda here, even in Kenya, even in Tanzania, even in Congo, who have these things, okay? So this is symbolically performed on many cultural, ritual, and social occasions, such as initiation ceremonies. For example, now that you are from puberty, now you are becoming a man, you know, like among the Bagisu, where they chop the men. So, but this one, in some of the cultures, they are going to either recep or mutilate. Okay, receping is even mutilation, but now mutilation here, I'm talking about extractions, you know, yeah. So this is cultural and, you know, transition from puberty to adulthood, and then, you know, a right for marriage, now that you are strong enough, okay, entry into the warriors society, and so on and so on. okay? And sometimes it is done on medical grounds, you know, the traditional medical grounds, to allow feeding in case of tetanus. You know, in tetanus, the jaws tend to lock, and so they come to learn that if to feed such a person, you may need to extract some of the teeth to allow for easier feeding. So they do this, you know, in advance for preventive purposes, yeah, from their traditional knowledge. Then also to allow more efficient spitting. You know, in some cultures, they don't like swallowing saliva, so they spit. So to make the spitting more efficient, they do this kind of extractions. Then some, they consider it for beauty, to improve personal appearance, cosmetics. Now for you, be seeing it as terrible, but for them it is cosmetics, okay? Then in some cultures is to mimic the appearance of an animal or just to avoid it, okay? Yeah, so if you mimic maybe a leopard, because your teeth now look sharp, maybe those animals may fear you. Then also to provide a form of tribal and intra-tribal social class identification. So it can be a social status issue and also tribal identity. You know, as Africans, we are so much tribal, and so Mnyankole, you are Mchiga, you are Mtoro, Ganda, or Gisu, or Acholi, or whichever tribe. So each person wants to identify with their tribe, and so they will do this, you know, to say, me, I belong to this tribe. And also maybe in this tribe, I belong to this social status. I'm the one who owns animals. Yes, so they use it as a marker. Then also to allow the emission of special linguistic sounds. Okay, special linguistic sounds. Yeah, I told you that the dentition are necessary for speech. So these guys modify their teeth in order to modify speech. In order to modify speech, in order to form certain special sounds, yeah, to make their language exotic. And then for some, it is to improve the masticatory function. You know, you want to make the incisors very sharp, like for those wild animals, in order to improve the tearing function. Yeah, the tearing function. And then in some of the cultures, it is to facilitate oral sex. Then in some, it is a sign of mourning, loss of maybe very important people in their family. So there are all these intentional dental rituals, and you will be coming across them in your practice as you move around the country, as you move across the borders, you know, you will come across these kind of things. They still exist in Africa, and so you need to be aware and be conscious how to deal with them, you know. Yeah, because that is the culture. How do you address cultural issues? And how to identify the culture of people, even from their dental practice, you know, rituals in the oral cavity. Yes, others even do, other than doing only the dentition, the others go to the length of mutilating their tongues, mutilating their lips, okay, mutilating their nose. I think you have seen, many slaves even, pierce their tongue and put their rings on the lip, down, up, everywhere, to show their celebrity status. This, you will also experience it not only in Africa, but even in Europe, even in America, because that is now celebrity status. But yeah, in Africa, some of the reasons for those mutilations are different. Some are, yes, I think abroad, maybe it is status, beauty, okay, yeah. In Africa, it can also be like that. And it can also be a tradition. Some traditions were that if you mutilate the lips like that, then during the slave trade, they are less likely to capture you because then you are not complete. Yeah. So it was to avoid being captured by the slave traders. So, but some of these practices have escalated. They are widespread. For example, the piercing of the tongue and the mucosa and the lips, presents a hazard. Yeah, those pins, the rings can dislodge. Yeah, and somebody can inhale and somebody can swallow them, and so it can create complications. So you, as a medical doctors and who are going to be in future specialists, you need to be aware of this, because your patient may present with, a foreign body in the lungs, but they were trying to make themselves a slave, yeah, by piercing their tongues and stuff like that. So this also broadens your understanding of those issues. Yeah, here is an example. Yeah, this, I think I've seen this kind of people. Now you can see this lady is trying to be as beautiful as possible. So as said, this, yeah, the upper centros, the upper 1-1 and the 2-1. You can see how they are being sharpened, they use a file, to file them. So this is now like a peg, yeah. And then the lower centros here have been extracted, yeah. So this now is a beauty, yeah. This is a serious beauty. Okay, wonderful. That is the end of the presentation. Now let me go to the chat room and try to let me look at some of the questions. Yeah, so the question, racial, genetic, yeah, it could be not so much genetic, as I said, but more of a cultural disposition. It's more of cultural disposition. How do people take care of their health? First, real, I said they're not real. These are socio-culturally constructed conditions. What are the risk factors of false teeth? Wow, this is a very, very, very serious question. The risk factors could be like any other disease. We can say they are social, they are cultural, they are biological, they are economic. Yeah. Yes. I think the socio-cultural risk factors I've explained. Biological can be due to the underlying biological disease, an infection, and nutritional deficiency, and so on and so on. And economic can be due to the fact that the parents or the caretakers lack the resources and to be able to go for the conventional healthcare. So then they end up going for the traditional healing practice as an alternative. And I forgot, in the cultural, social cultural issues, don't forget the fact that the diseases are context specific, and healthcare decisions sometimes are orchestrated by the family or the community. The community or the family can dictate how healthcare is accessed. So those issues are all the contributing risk factors. Okay, I can see there are many other messages. Okay. Okay, Alex, I think has muted. What happens if you leave the first teeth to grow? Can they become real? The answer is definitely no. Since it is not a biologically known entity that is something called false teeth. As I said, okay, maybe, which I need just to reiterate, I'm sure you must have learned this in dentition. You very well know in embryology, in the embryogenesis, that by the 8th week, the oral cavity is actually in place. And by that time, even the primary dentition are in place. And later, the tooth jams, several weeks later, the tooth jam or the teeth jam for the jams for the permanent teeth would have even already started forming within the mandibular and maxillary arches. Yeah, they will, of course, they will be just at jam level, but they will be present. Okay, so so the process of dentinogenesis and eventually, yeah, will continue until when a baby is born, and then when mineralization takes place and this primary teeth emerge. Yeah, so yeah, so basically what is inside is not a false tooth, it's just a tooth jam. Okay, which I think Dr. Quizra explained for you people. So what then the person will get will be a normal tooth, not a false tooth. And another question is, I think, about science. Yeah, but is the tooth eruption associated with certain symptoms of infection? I think the answer is yes. The answer is partly yes. Now, what happens is when a baby is at around the age of 6 months, when this primary or milk teeth, the incisors are beginning to emerge. That is also the same time when these babies are very active, you know, crawling all over the place, and they have, you know, this oral stage. You remember in health psychology, everything they find they want to put in their mouth. And because during that stage, also there is possibility that maybe these babies can expose themselves to microbes, which can actually infect them, because everything they find, they just want to put in the mouth. Yes, so though there are some people who have also argued that that physiological process of the normal eruption creates inflammatory process, which creates fever. So the evidence for that is not yet sufficient, but there is some papers out there which argue like that. And so when there's a fever, of course, you know, there will be kind of ill feeling. Yeah, so infection or just normal physiological response, we are not at 100% certain, but the possibility exists. Where is okay, that's now the discussion of why do we mutilate the teeth? Okay, yeah, you know, some people practice oral sex, and so that is their business. But for us, it's just knowledge. So how is this topic related to medical management? Wow. I shouldn't then be asking the class. I should be asking the class. If Yusuf was there in the middle of the class, I'm sure he should have got this answer. But maybe if can somebody put up their hand? I can see some of the class has fallen off. I don't know why, but can somebody put up their hand? And yes, I can see one hand is already up. Let me see who is that? Oh, I'm not seeing the, okay, you can unmute, and because you are the only one who has put up your hand. So unmute and tell us, why is this topic relevant?
Yeah, thank you, doctor. I don't know whether you hear me. I'm very far.
I hear you sound and clear.
Thank you, doctor. I wish to inform my colleague that this topic is not a waste of time. It is very relevant in the practice of a medical practitioner. One, I've been in practice for the last 10 years, and I've encountered several cases, many of which we have discussed here, including their complications. So it is incumbent upon us to be equipped with the knowledge. You may be handling a child with the Tankuram oris, not knowing that the origin was a false teeth extraction. You may be handling a child with stomatitis, or even alveolar abscess. I've come across even mandibular stomatitis, but the origin was a false teeth extraction. So it is very relevant. You don't know which community you're going to work in. So you rather be equipped with the knowledge to differentiate that, no, this is not false teeth. Let's manage maybe septicemia. Let's manage maybe dehydration. Let's manage maybe fever, so that you are equipped and manage the child very well.
Thank you, Buire. Thank you so much. That's why I was wondering. Okay, it is good he asked. You know, if he didn't ask, then you wouldn't have helped us to clarify, because somebody may be thinking that maybe we are just wasting time talking about such things. But I've said that papers are coming from Europe, Australia, even in the US, describing cases of forced practice in those highly developed countries among immigrant populations from Africa. You may think we're talking about nonsense here, but you will find yourself practice maybe in London, and you will not know what is happening to your patient. Yeah. But when you have this knowledge, then you will be able to recall, wow, this is what we were discussing in the class during COVID. So we are not talking about something which doesn't exist. We are talking about something which is existing, even as we are speaking in now. Okay, as we are speaking in now, somewhere in this country, somewhere in Africa, a child is being subjected to this practice, and another child is dying as a result of the complications. So, yeah, so I hope you have gotten the answer, and there are still, there are many other questions. Okay, that was that question. Now let me see. Let me see, there are some other 4. Okay. Can bite off your man. Oh, now that is serious. Those are now some serious discussions. After hearing from Wira, I rest my case. Good. Yeah, Yusuf, that's good. You now appreciate. I think all those who are present appreciate why we must discuss these issues. Okay, I think now there are no new questions, and yeah, it has been really wonderful having you people in this class. And so on Monday next week, if all going well, we should be able to finish. And I'm going to try to discuss something about tooth extractions. And it will be a short class as well. And please, you can read ahead of time, so that when we come to that class, it will be more of question and answer. Maybe, yes. Thank you also, Alan. Thank you, class. It has been so beautiful. Yeah. Oh, yes, I know data is very expensive. I apologize, but we had to do these discussions. I know these are issues which are affecting everybody. Yeah. You see, today I'm talking because I'm in the office. I know what it means to buy data. So I wish all of you,
Thank you, Doctor.
yeah, a blessed
Thank
week.
you.
And yes.
Doctor.
Yeah.
Doctor.
Hello.
Yeah. Yes. Yeah. As you prepare maybe for next week, also you told us you teach us about clerking and history taking in dental.
Okay.
I hope you have
So yes. So let that be part of what we're going to do next week.
Okay, Doctor. Thank you. Just
Okay,
reminding.
okay, good. Okay, fantastic. Yeah. So have a blessed week, class.
Doctor.
Yes. Hello, come here. Hello. Oh, you are muted.